Hi, I'm Dr. Chris. You know me as the founder of MUSCLECARE, my all-natural topical pain, spasm, and inflammation reliever. Today, I'd like to talk to you about back pain. Back pain is something that's quite universal. It's the #1 global disability in Western countries. It infects everyone from age 15 to senior citizens and beyond. It is something that is basically an epidemic. It affects at least 80% of the population, and we'd like to get a handle on understanding it to try to give you better suggestions or solutions to help your back pain.
The Annals of Internal Medicine published an article entitled Management of Acute Pain from Non-Low Back Musculoskeletal Injuries, a systematic review and network meta-analysis of randomized trials, August 18th, 2020 publication date. Out of 207 studies, 32,959 patients, and 45 different therapies, the researchers compared the treatments to address acute pain from non-low back musculoskeletal injuries. All common drugs and natural therapies were evaluated, including opioids, non-steroidal anti-inflammatories, both topical and oral, non-surgical anti-inflammatory drugs, chiropractic care, physiotherapy, etc. Musculoskeletal injuries account for over 65 million healthcare visits in the United States alone each year. Of the patients who visited the hospital for an emergency of acute pain, 40% of them reported leaving in the same or actually more pain than they arrived, and 74% were discharged and sent home in moderate to severe pain. Hospital visits for acute mechanical pain do not work. These injuries included sprains, strains, whiplash, neck pain, non-surgical fractures, contusions, upper back pain, etc. The topical non-steroidal anti-inflammatory made a positive effect on physical function and patient satisfaction compared to other therapies. A second article came out immediately following this first one in the Internal Medicine Scientific Journal, and it's entitled A Clinical Guideline from the American College of Physicians and the American Academy of Family Physicians. This means that there's a dramatic push to minimize opiate and internal drug for acute pain, and a massive push forward to use topical first 7 days of acute pain, musculoskeletal injuries, to lessen side effects and reduce addiction.
I developed MUSCLECARE for back pain because I've been a chiropractic doctor for now 32 years. I've seen over 20,000 patients. The majority of them are back pain related cases. And what we found is that most people don't want to take medicines or drugs anymore. They want something that's natural. They want something that's effective. But in that topical industry, most of the large pharmaceutical companies don't really put a lot of effort into the topicals. They would build something that has menthol in it that would make you feel cold, or they would build something that has camphor in it that makes you feel hot, or sometimes both. But the reality is that it really doesn't do anything to help change the pain for the long haul. So with scientists and chemists on my side, after 22 years in practice, we decided that we would put together a formula that used a very simple principle in physiology. And that's where calcium contracts muscles, magnesium relaxes. So we have a technology that drives magnesium instantaneously. And I swear to you, within 30 seconds, it pushes magnesium into those tight muscles. So wherever there's pain, there's going to be nervous system's excitation, and the nerves are controlled by the muscles, so the muscles are spastic or tight. Now, what happens is there's little bridges that form called cross bridges that lock the muscle in that way. That's why when you have pain, you don't move very well. You're very stiff or immobile sometimes. So what happens is that our magnesium pushes in very quickly and breaks the cross bridges so that this happens, relaxation. When relaxation happens, all of a sudden, fresh blood flow that was sitting outside of that spastic muscle, that tight muscle, that has lots of nutrition and lots of elements like magnesium, etc. in it, will be pushed through that muscle, helping more relaxation and actually remove the chemicals that cause the inflammation and pain. So many of you might have heard of lactic acid or substance P or prostaglandins. All of these things are part of the excitation of nerves that create pain to your brain that can't shut off sometimes because you can't get rid of that spasm. So much like chiropractors, much like massage therapists, we work to break the spasm and flush out the bad stuff so that good stuff can come in. So what happens is not only do we take away the pain and inflammation feeling, we take away the spasm, We improve the movement then. The person can move much better. But at the same time, we allow for, again, nutrient-laden fluid or blood flow to get into that muscle and that tissue again. So if it's been going on for 6 months or more, we have damage. We have damaged tissues. And what we want to do is help those tissues to repair. So MuscleCare is great at resetting the tissues back to their normal state and helping you get better. If you have back pain, MuscleCare is a great venue to help you, but again, there are other things you can do. You can do stretches. And I've learned that the people that have a morning stretching routine or a morning exercise routine, or the two together even better, when they've done this over the course of their lives, they have way less likelihood of pain. And what that means is that they're in control. The pain's not controlling them. And this is a massive factor when we're dealing with back pain, because back pain and other pains like that can control us, and we don't want that to happen. Ways to assume control are morning stretches and exercises, strengthening the back, stretching the front, opening the legs, the hamstrings, etc. And remember, all of your stretches need to be held for at least 30 to 60 seconds or until you feel that stretching or tight feeling go away. And believe me, if you hold it long enough, it will go. But sometimes it can take up to 5 minutes. And this is where we find that if people do develop some stretching habits, they are very quick to go through their routine rather than making it very deliberate and intentional. We would strongly encourage you to do your stretches, and we're happy to provide those for you too. So we will happily send you my free daily stretching routine, no cost at all, ever. But this is just to help you take charge of your life again. And if you're a senior, we have a senior's routine. So again, you could ask us for that, and we're happy to send you that. The other thing that we have is we've taken from my best-selling stretching book an exercise routine for back that's safe. And it doesn't involve a lot of crunches or sit-ups and this sort of thing that are actually harmful to the back joints and discs. We're happy to send you that if you'd like, just to assume, again, more control of your own problems. And even if you don't have problems, start doing stretching and exercising now so that you proactively minimize the chance of a back pain flare-up. Because as I said before, at least 80% of the population at any given time will have back pain. And usually once you get it, you have about a 6 times more likelihood chance of it coming back. Learn from those lessons. If your back pain comes and then goes, don't stop taking care of yourself. It's really important to stay the course. So that might mean doing your morning stretches and exercises. It may mean going to a chiropractor once a month. It may be seeing a massage therapist once or twice a month. These sorts of things are really beneficial in minimizing pain from coming back. On the back pain front, we have 2 or 3 different kinds of back pain that are super common. One of them is where the joints compress in the lower back. That's called the facet joint. The facet joint pain makes up about 78 to 80% of all back pain. So what happens is generally when we slouch, which a lot of us do, especially with our technology age that we're in today, we slouch, we compress our joints and they lock together. And that irritates the nerves and that gives us an achiness or a pain in the back. Now, if we really compress the cushion between the vertebrae, we jam our joints even more and we start to get these sharp pains in the back, into the buttocks sometimes, and even down the legs. So when the sharp pain shoots down the legs, we call that radicular pain or true sciatica pain. And that's scary, no question, totally scary. And you really need to see somebody sooner than later. There are a number of reasons why it can happen, but usually it's the joint completely jammed, it's a muscle in intense spasm, or it's a disc that's pushing into the nerve canal, hurting that nerve. Go to the doc, go to the chiropractor immediately, and try to get things fixed that are causing the imbalance, that are creating that pinch. The other types of back pain are generally the sacroiliac joint. That's the hip joints at the back, where you walk from. That makes up about 21% of cases. So sacral joints, they feel better when you walk. So if you hurt and you move and you feel better, that's probably your sacroiliac joints. And another way you know that it's the sacral joints that are jamming is that when you try to get out of a chair, you feel like an old person. And we call that the chair sign. Hard to get out of the chair sign, sacral joints. And they love to walk, they love to lie on your back and hold the knee to the chest and stretch. That's what you're trying to do more of. Keep the gluteus muscles around the sacral joints mobile, and this way you'll minimize compression of the sacral joint and you'll find the pain and inflammation goes down. Again, those are the 2 most common. The disc herniation is incredibly rare, and that's the severe one where the disc bulges and pushes on the nerve. But again, extremely, extremely rare, and oftentimes overdiagnosed in the medical community. Really remember that the disc only herniates or bulges Some people used to call it the slip disc. It doesn't slip. It just bulges or swells up and pinches the nerve. But really in about 0.5%, maybe 1% of cases. Again, joint, sacroiliac, more common. All of these joints, when they jam up, they irritate the nerves and the muscles get involved and they spasm as well. So this is why we like to say that MUSCLECARE is really beneficial at relaxing muscles, penetrating the joint, reducing inflammation, and going from there. The roll on that I have is gonna be sealed when you get it, and all you do is just twist it a little bit, and you'll see that the seal comes off. You undo the top, and all you have to do is roll it and cover the area once in the lower back. If you feel lower back pain, spread it across the lower back. Do it as many times as you have to in the course of that day to absorb enough magnesium to break your cycle of pain and spasm. So there's no limit. If you want to use it 8 or 10 times, you can. It's perfectly safe. And I say that because we actually have a published double-blind study from University of Toronto, Mother Risk and Sick Children's Hospital that showed every ingredient in this composition in our roll-on and our cream format are safe to use when a woman's pregnant or nursing. So we're very proud that in 2015, this study was published in a medical journal. So safe to use even when your woman's pregnant. We also have an efficiency study where we were compared to all of the leading national brands. So every big brand that you see sold at your local pharmacy, we went against in 2012. And we had a published study come out of the Canadian Memorial Chiropractic College and Biomedical Journal. And it was demonstrated for us very clearly by third-party researchers that MUSCLECARE was the number one. It outperformed the leading mass brands that you see at your drugstores and pharmacies, and it beat all of the professional brands as well. It is safest and strongest national brand MUSCLECARE. We've been in all of the drugstores, the Walgreens, the Duane Reads, the HEBs, EB Games, the shopping channels, QVCs. We had tremendous success, but to be very honest, we find it much more cost effective for our patients and our customers to buy it from our website. So getmusclecare.com, amazon.com, and honestly, those are the 2 places we sell. That's it. So if anyone else is trying to sell to you, they're probably not selling my product. Make sure that when you see my product, it has a seal on it. We have a 3-year expiration, which is a year longer than most products. We're very stringent with respect to our testing. And again, as I said before, I built this for people with back pain like you. I built it out of frustration because even though I have a team of 30 practitioners that work with me, we can only see so many people, and back pain is endemic. It's everywhere.
The most common approach is being evaluated currently in 59 trials for acute pain from non-lower back, musculoskeletal injuries, or physical therapy, joint manipulation, chiropractic care, topical NSAIDs, and electrical stimulation. In 2017, the University of Toronto, in their performance lab under Dr. Jack Goodman's guidance, conducted a large randomized clinical controlled double-blind study where drug topical cream, Voltaren, NSAID with diclofenac, was compared to an all-natural topical pain cream and roll-on called MUSCLECARE. MUSCLECARE marginally outperformed Voltaren, and it accomplished that with all natural ingredients.
So we're trying to figure out ways to have, we call it, we joke and we say it's like Dr. Chris in a bottle. This is better than taking pills. It's better than taking anti-inflammatory creams. We've been proven to outperform those as well. All natural, no dyes, no parabens, no coloring agents. Most people hear that and they think, okay, that's good. That makes a lot of sense. It makes even more sense if I explain it to you, because the parabens, dyes, and coloring agents are actually something that absorbs immediately into your 1,600 pores per square inch of skin. And when that happens, the nerves inside of you don't like it. And they start to get excited. They crank up. And what happens then is that because they're firing way faster, all the muscles around them tighten up even more. So most of these other companies were using these products, parabens, dyes, coloring agents, as binders to make it look pretty. But what it was doing was, in fact, it was making people more pain sensitive, and that was proven on the double-blind studies that we actually have had done. So I encourage you to look at the labels, read the labels, and know that these bad ingredients can have a negative or harmful effect. Today, I've already said to you that if you send us a note, happy to send you my daily stretch routine or my senior stretch routine, my exercises. There will be a substantial savings for those who want to try MUSCLECARE for their first time. This is not about the money. This is about helping people break the epidemic of back pain that goes along with the chronic pain cycles that are happening everywhere. For example, 116 million people in America, that's 1 in 3, suffer from chronic pain lasting longer than 6 months. I'm here, I'm a doctor first, and my intention is to help break pain cycles and help tissues heal and get better for the long haul. I'm happy to help you wherever I can, whenever I can, and to even show that my best-selling stretching book called Stretching for Fitness, Health, and Performance, we built into an ebook that's really easy to read. It's 89 pages, it's super current. And you know what? Send us a note today and I'll send you that ebook, $39.99 value for free. All I want to do is help you get out of pain with respect to the back problem so you can go back to walking, getting out of a chair, hanging with your friends, playing sports, lifting your grandkids, snuggling your wife or spouse. It doesn't matter what it is. I know that you're suffering. So let's not suffer anymore. This is a simple, easy way to gain control and get the pain down, the inflammation down, loosen the muscles, and just start moving. Because once you move, you're overriding the pain nervous system anyway. So this is how you start to heal and take control. I'm Dr. Chris, and this was our back pain session for today. There will be more, so stay tuned. Thanks so much, and have a great day.